Hi, my name is Adriel William, and today's video is for all the applicants who are trying to figure out which school is a good school for DDS, or if I got multiple acceptance, how should I pick the school where I should be going? So I'm going to try to make it simplify for you, and specifically coming from my background as a foreign trained dentist, I'm going to give you that perspective as well. So if you're a conventional student, a local DDS student, was born and raised in US and you're applying to 4 year of DDS, one of the two things that you should look upon is the fee structure. Which school is going to be more expensive for you? Because if you're somebody who lived in Colorado and got accepted to Colorado, most probably you're going to save some money being an in-state student. On the other hand, the second thing you should look into is that if you want to apply for a postgrad, if you want to go for a postgrad residency, there are certain schools who have a higher match rate. For example, UPenn, Boston, uh, NYU, USC, Columbia. These schools have higher match rates. So if you want to go into a research, Columbia is very famous for getting match. So these are some schools which have higher match rates. So if you want to pursue postgrad, going in those schools will comparatively increase your chance. It doesn't mean if you go to Colorado or Harvard, you won't get accepted, but comparatively, most students who go there end up going to postgrad. So those are the two main criterias that you should look into. Now, coming to foreign trained dentists like me, who did get some clinical experience beforehand, even coming to US, and now they are applying to DDS to get their license, and they are at a certain age of life. Number one thing I'll tell you to understand that America is very much based on business. This is a very strong capitalist economy, and education and healthcare are two big businesses up here. Dentistry at the moment is $1 billion industry in US. And one of the reasons they make it so difficult for you and me to get accepted to a dentist school is because once you cross that threshold, once you get accepted to a dentist school, you will be in a fraternity where you can end up earning millions of dollars. If you have the right mindset and you have the capability to do it, there will be opportunity. So it's one big business. So by the end of the day, even dental schools will charge you a hefty amount of money, starting from somewhere $300,000 to $600,000, $500,000 loan to get that DDS. So my suggestion on number one to everybody is, if you got multiple acceptances or you're applying to dental schools, once you get acceptance, compare it in a way whichever is going to cost you the least amount of money and which will be the shortest duration for you, so you can graduate, come out and start working. Because as we grow older, time is of the highest essence. You can make a lot of money, you can make new friends, you can do a lot of things, but one thing you can't recover is time. And it's a very sad reality of dentistry right now. I've talked to a lot of dentists, I've talked to retired dentists, and they say the aim is to get in dentistry early on in younger age, make money, pay your loans, and save some money to build equity and quit as soon as possible. Because after a certain age, you don't want to work 5 days a week. You want to maybe work 3 days a week or 2 days a week and just go and do procedures which you like to do. You don't want to be under somebody's else employment where you're being told what to do and you have to see 40, 50 patients a day because you're an employee. That's very troublesome and it's taxing physically. So right now, the way people are looking at dentistry is that it will pay you a lot, but it will age you a lot as well. It's like being on a ride of F-16 where the G-force is so much that you age really fast because of the gravitational pull. In the same way, dentistry will pay you, but when you start working, it's a lot of stress in a very short amount of period. So number one suggestion, look for schools which are less expensive. The second thing is, a lot of people who haven't even gotten an acceptance, they will say, which is a good school I should apply as a fresh graduate or as a master's holder. To be honest, at this point of time, my suggestion is apply to as many schools as you financially can. You want to cast your net as wide as possible. And my criteria would be look for schools that has the highest number of spots. For example, Boston has 60 to 80 spots. Colorado has 40 and NYU has about 30 to 32. So these schools have a lot of availability of chairs. Those schools should be on your number one priority because it increases the chance of getting accepted. On the other hand, maybe SIU have 8 spots. Now the chances of getting accepted to SIU where you have 8 chairs and Boston where you have about 60 to 80, Boston have a higher chance. So you want to apply and figure out the schools which have more chairs available. Put them on your list. After that, if you're applying to 15, 20 schools, once you look at all of these schools, research and apply, then you can apply to other schools with smaller number of chairs as well. The other thing I'll tell you is that once you get a couple of acceptances, then you can start comparing which school is more expensive, which is less expensive, which is closer for my family, which is not, in which area will I graduate early and start working. That's when you can make the comparison early on. For the lack of better term, and I was there, beggars can't be choosers. We can't do anything, and don't be picky even before getting an acceptance. At this time, you need to apply to as many schools, and once you have those couple of options, then start comparing. The other thing is, if you're somebody who wants to go for postgrad, maybe you should try looking into school which have a higher chance of getting getting matched. For example, USC, NYU, UPenn, as I said earlier. Now, it doesn't mean you can't get accepted from other schools. You can. It's just you have to work harder. You have to go for internships, make contacts. By the end of the day, whether it's India, Pakistan, US, Turkey, Albania, Malaysia, wherever you are, contacts matter. Even if you're applying for postgrad, you want to go make contacts, make connections so people will be willing to give you a chance. So regardless if whatever school it is, you can get accepted to a postgrad residency, but you need to plan ahead. You need to have good grades and you need to go for externships and make connection. The other thing I'll tell you is that some people will ask me which school will give me more clinical exposure. There are some schools, to be honest, when I look upon them, had a little bit more, and I was much more interested in surgery experience. That was my first question I asked people is how many extractions or surgical extractions or flap did they let you raise? I was amongst the, I would say, blessed in Colorado that one of the coordinators who ran the surgery department, she was gracious enough to give me alveoloplasty cases, post-op cases, and she will let me do extra extractions as well. But most students don't get to do surgical extraction in Colorado. That's just the policy of the school due to liabilities or whatever the reason is. Now, on the other hand, UCLA, the patient pool they get is comparatively very, very low because it's a research school and most of the people who are patient will end up going to USC rather than UCLA, and they end up going on community rotations in dental, community healthcare centers where they get to do patients because there are not many people who are coming into the school, which is sad. Now, USC gets to do more hands-on surgical dentistry as well. University of Alabama, I've talked to students, they get to do far more hands-on stuff as well. I feel there is a little bit this kind of difference, but by the end of the day, one school will let you do 10 extraction and the other one would let you do 20. That should not be a reason you should end up spending $100,000 more. The clinical exposure, if you truly want to get clinical exposure, I'm going to be very honest, you're not going to get it in DDS. DDS is not meant to teach you or give you a lot of clinical exposure. DDS in US is only made to teach you how to not kill a person and how to be very careful with your basic procedures like SRP, perio procedures, filling, maybe simple extraction and doing crown preps. That's what DDS is made for. Now, if you want to learn beyond that in clinical exposure, either you're going to go into a GPR residency or a specialization residency, or you're going to end up investing in a lot of expensive CE courses and learn on your own. I personally got to do a little bit surgery in Pakistan, and now up here after my DDS, I've been investing in CE courses. I've been trying to work with people who are willing to teach me, who are willing to guide me, and that was one way to increase my exposure rather than going for a GPR on a residency at the age of 33. I just didn't feel it was a suitable option for me to do further schooling in my life, where I have already spent 30 years in colleges and universities. So to summarize this, I'll say, remember, when you're young, you'll feel like, oh, $50,000-$60,000 of loan is nothing. I want to go to UPenn. It's more prestigious. But by the end of the day, you're always negotiating with the 40 years old you. Whoever you're going to be after 10, 15 years, you're negotiating with that person. And that $100,000 of loan that you take in 2024 or 25 with interest will end up to 200,000 or 150, which means you're going to be slave to the financial system 5 to 10 years longer. You won't have vacations. Your family wouldn't have a comparatively that much of a better car. So by the end of the day, to give yourself a better lifestyle and keeping your stress level low, my suggestion is look for a program which won't cost you more money and which will graduate you early. So if you want to go for a GPR or you want to go for a private practice, you can start doing it as young as you are, in a younger age, as soon as you can. The other thing is, if you really, really want to get good clinical exposure, it's hard to get in, but if you can get accepted as a foreign trained dentist into a GPR or AGD, directly go for it. I had one student who got accepted to a GPR and then got accepted to DDS, and I was telling her not to go for DDS. It doesn't make sense. You're going to spend so much money, and again, they will teach you the basic didactic and class 2s. I wouldn't spend all that money when you're already placing implants in your GPR. Graduate and go into a state where you can get licensed like Ohio, Virginia, Washington, and make money and get good C courses. So I know this video has a lot of information. If you have any questions, you can still put it in the comment. I'll try to answer them. Hit the like button if you found this useful. Subscribe to the channel, because that means a lot to me. Whatever feedback, there are few people who give me feedback. Most of the people who watch my videos aren't even subscriber for some reason, and I would request, if you subscribe, if you write a comment or give me a feedback, that's a very strong encouragement for me. And hopefully, if you have any more questions, I'll try to make more meaningful video. And all the best.